more than 10,000 patients still need medical evacuation out of Gaza. We ask member states to accept more patients, and we ask Israel to allow these evacuations and to allow urgently needed food and medicine to enter Gaza. WHO stands ready with our UN partners to move rapidly to deliver it if and when it's allowed to enter. In Sudan, an estimated 32,000 people have been killed. 30% of the population is displaced, and 20 million people need humanitarian aid. I visited Sudan in September, where I saw the effects of the civil war and met people who are paying the price. The following week, I was in Chad, where I traveled to the border town of Adre and met some of the 900,000 Sudanese refugees who have fled seeking security and food. And they're just a fraction of the 122 million people globally who have been forced to flee their homes. In Gaza, Sudan, Ukraine, and elsewhere, we continue to see attacks on healthcare, which are becoming a new normal of conflict. Last year, we verified more than 1,500 attacks on healthcare in 15 countries and territories, killing more than 900 people. In every country, the best medicine is peace and a political solution. I hope peace will prevail that can transcend generations. War is not the solution. Peace and political solution is the solution. In response, Thank you. In a response to the lessons learned from COVID-19 and other health emergencies, WHO is supporting countries to strengthen their capacities through the Health Emergency Preparedness and Response Framework. We're supporting countries to strengthen their capacities in genomic surveillance, and every day we scan the world for public health threats through the epidemic intelligence from open source platform. Last year, we assessed more than 15 million potential signals from 13,000 sources. The Pandemic Fund has provided $885 million in grants, catalyzing an additional $6 billion in co-financing, supporting 47 projects across 75 countries. Through the WHO Hub for Pandemic and Epidemic Intelligence in Berlin, the International Pathogen Surveillance Network now connects 350 organizations in 100 countries. You know, the Berlin Hub is a product of the lessons learned from COVID-19. And the research and development blueprint for epidemics and pandemics is managing collaborative open research consortia for 12 families of pathogens involving over 5,000 scientists to drive R&D and identify gaps in countermeasures. I would especially like to acknowledge the Oswaldo Cruz Foundation in Brazil, Fiocruz, which is leading one of those consortia. I thank Fiocruz for its partnership and offer my warm congratulations on its 125th anniversary. Feliz aniversario, Fiocruz. I had also a very good partnership with Fiocruz when I was Minister of Health in Ethiopia and started the monitoring and evaluation master's program that strengthened our health management and information system. So, obrigado, muito obrigado, Fiocruz. The mRNA technology transfer program, based in South Africa, is now sharing technology with a network of 15 partner countries globally. The Global Training Hub in the Republic of Korea has helped to train over 7,000 participants in biomanufacturing. These two, the Cape Town and Korea also, South Africa and Korea are also based on COVID lessons, including the BioHub which is facilitating sharing of samples to address the sharing of samples challenges we faced then. And just last month, the Global Health Emergency Corps ran a 2-day simulation called Exercise Polaris with 350 experts from 15 countries to test capacities for deploying and connecting health experts during health emergencies. Through the Open WHO platform, more than 9 million people accessed learning, supporting the response to 26 outbreaks. At this assembly, last year, member states adopted a package of amendments to the international health regulations, and WHO is supporting countries to prepare for their entry into force in September this year, 2025. We're also supporting voluntary national and global peer reviews of preparedness through the Universal Health and Preparedness Review. Last year, we supported 19 joint external evaluations, 28 after-action reviews, and 34 simulation exercises. And for the first time, we have 195 countries reporting on their IHR capacities through the States Parties Annual Report, the SPAR. So based on the COVID lessons, there are significant changes that are happening, and we need to continue to push. In addition to these general preparedness activities, we're also supporting countries to prepare for specific threats, including Ebola. With Gavi, we vaccinated 150,000 health workers in 6 countries against Ebola. The first time this has happened outside of an outbreak response to prevent any future outbreak. We also supported the vaccination of 65 million people against yellow fever in 4 countries. And through the Global Influenza Surveillance and Response System, GISRS, more than 12 million samples were collected and tested, and 50,000 samples were shared with WHO influenza collaborating centers. We recommended 9 new zoonotic candidate vaccine viruses available globally to manufacturers to produce vaccines in case of an influenza pandemic. As we have agreed, preparation is continuous. That's why. Honorable ministers, dear colleagues and friends, all of this work to promote, provide, and protect health is supported by our efforts at all 3 levels of the organization on the 4th and 5th Ps of GPW14 to power and perform for health through science, digital technologies, data, and our ongoing transformation. Last year, we conducted a review of our transformation to see what has worked and what has not. Based on the review, we have reprioritized transformation and aligned it with priorities of the GPW14. One of the successes of transformation has been our increased focus on science, data, and digital health, and this is the future of the organization. WHO's normative standard setting work is its bread and butter, and we have streamlined processes to give member states the highest quality evidence-based advice as fast as possible. Last year, there were 65 million downloads of WHO publications, guidance, and other materials. We launched important new guidelines on avian influenza, artificial intelligence, clinical trials, tobacco cessation, Mpox, and so much more. Starting this year, we're aligning our guidance and normative work with pre-qualifications, meaning we will pre-qualify a product and issue guidance on how to use it at the same time. The first product under the new process will be lenacapavir, an exciting new medicine for the treatment and prevention of HIV. Although a true HIV vaccine remains elusive, lenacapavir is the next best thing, an injectable antiretroviral taken every 6 months that has been shown to prevent almost all HIV infections in those at risk. We expect to conclude both the guideline and pre-qualification processes this year, which will support the subsequent rollout of this product. Another success of transformation has been our increased focus on digital health. Over the past 5 years, WHO has supported almost 75% of member states to develop strategies to harness digital technologies, including artificial intelligence, to strengthen their system. WHO hosts the Global Digital Health Certification Network, which last year enabled the Kingdom of Saudi Arabia, Oman, Indonesia, and Malaysia to issue 250,000 international patient summaries for 2024 Hajj pilgrims, supporting emergency care for 78% of scanned records. Many more countries are joining this year. The network now covers 82 countries, benefiting nearly 2 billion people. I thank the EU for its continued support for this work. Another key element of our transformation has been our focus on data. Every country in the world now accesses the World Health Data Hub, which is a secure and standardized pathway to increase transparency, accountability, and progress. Honorable Ministers, dear colleagues and friends, I hope you agree that we have many achievements to celebrate. But we also know that many countries face significant challenges. Many ministers have told me that sudden and steep cuts to bilateral aid are causing severe disruption in their countries and imperiling the health of millions of people. In at least 70 countries, patients are missing out on treatments. Health facilities have closed. Health workers have lost their jobs, and people face increased out-of-pocket health spending. Although this is a challenge, many countries also see this as an opportunity to leave behind an era of aid dependency and accelerate the transition to sustainable self-reliance based on domestic resources. We're doing our best to support countries to make that transition. And yet, at precisely the time the member states need a strong WHO, it's being challenged. Although our current situation is difficult, it should not be a surprise to any of us. It's a situation many years in the making, and one that we saw coming. When we began the WHO transformation 8 years ago, as soon as I started my Director General tenure, one of the main problems we set out to address was WHO's over-reliance on earmarked voluntary funding from a handful of traditional donors. We have implemented several measures to alleviate that problem with your support, as you know, the past 5 years. We published the first investment case, established the WHO Foundation, conducted the first investment round, and 3 years ago, the Health Assembly took an historic decision to increase assessed contributions progressively to 50% of the base budget. This is the highest increase in the history of this organization. And thank you for your confidence and for that historic decision in 2022. This week, I ask you to approve the next increase to make another step toward securing the long-term financial sustainability and independence of your WHO. Already, the first increase has made a huge difference. If it had not happened, our current financial situation would be much worse, $300 million worse. Even so, we are facing a salary gap for the next biennium of more than $500 million. The Secretariat has taken a range of measures to curtail costs in travel, procurement, recruitment, early retirement, and more. These measures have helped to narrow the gap, but still there is no alternative but to reduce the size of our workforce. We're doing this reduction carefully to protect the quality of our work and ensure that we are positioned to emerge from this crisis stronger, more empowered, and more independent. As you know, we have been engaging in a major structural realignment, guided by an in-depth analysis of priorities, deliberate and conscious. The prioritization exercise has informed the development of a new streamlined structure for headquarters, which reduces the executive management team from 14 to 7 and the number of departments from 76 to 34. Some member states call the new structure lean and mean. I think it's more focused and it could be more impactful as well. Last week, I announced our new executive management team, and in the coming weeks, we will decide which directors will lead which departments. This was an extremely difficult decision for me. You can imagine that, and many of you have said that when we met, as it is for every manager on our organization who is having to decide who stays and who goes. I wish to place on record my deep gratitude to the outgoing members of our executive management team. Dr. Mike Ryan, Dr. Samira Asma, Dr. Bruce Aylward, Dr. Katarina Beme, Dr. Lee Ailian, and Dr. Jerome Solomon. Each of them has served the organization and the people of the world with distinction and dedication. And again, of course, without I ask you, you did it, but again, I ask you to join me in thanking them for their contribution and for the job well done. Thank you so much. Excellencies, let's be clear. A reduced workforce means a reduced scope of work. The organization simply cannot do everything member states have asked it to do with the resources available. This week, you will consider a reduced program budget of $4.2 billion for the 2026-2027 biennium. This represents a 21% reduction on the original proposed budget of $5.3 billion. Assuming you approve the increase in assessed contributions, and thanks to the investment round, we're confident that we have already secured more than $2.6 billion, or 60% of the funding for the next biennium. That leaves an anticipated budget gap of more than $1.7 billion. We know that in the current landscape, mobilizing that sum, that amount, will be a challenge. We're not naive to that challenge. But for an organization working on the ground in 150 countries, with a vast mission and mandate that member states have given us, $4.2 billion for 2 years, or $2.1 billion a year, is not ambitious. It's extremely modest, and I hope you will agree with me. And I will tell you why. $2.1 billion is the equivalent of global military expenditure every 8 hours. I don't know how many of us know this. $2.1 billion is the price of one stealth bomber to kill people. And $2.1 billion is 1/4 of what the tobacco industry spends on advertising and promotion every single year. And again, a product that kills people. It seems somebody switched the price tags on what is truly valuable in our world. I will share with you a story. At the Munich Security Conference in February, I'm a regular attendee of the Munich Security Conference since I became foreign minister in 2012. I haven't missed except during COVID. At that conference, a foreign minister spoke to me about the large increase in defense spending announced by some countries. Not some countries, actually many countries. Many countries are doubling or tripling their defense spending, and everybody knows this. And this is billions, hundreds of billions, and trillions. And he said, we have to prepare. When I asked him, he said, we have to prepare for the worst. I said, I understand, but what about preparing for an attack from an invisible enemy? Because you're only considering the visible ones, the tanks that may roll into your border, or the drones that may come overhead. How about the invisible enemy? The COVID-19 pandemic killed an estimated 20 million people and wiped more than $10 trillion from the global economy. I don't think you remember any war in recent memory that killed 20 million people. Countries spend vast sums protecting themselves against attacks from other countries, but relatively little on protecting themselves from an invisible enemy that can cause far more havoc and damage. If we think $2.1 billion in a year is ambitious, or 4.2 billion for a biennium, then either we must lower our ambitions for what WHO is and does, or we must raise the money. I hope you will go for the latter. And I know which I will choose, and I hope you will choose the same. On that note, I remind you of tomorrow's investment round event, and we look forward to seeing new pledges from member states and philanthropic donors. Honorable ministers, dear colleagues and friends, in 1951, the newly born WHO was already being buffeted by the prevailing geopolitical winds of its time, just as it is today. In her opening address, the acting president of the World Health Assembly that year, 1951, Ms. Rajikumari Amrit Kaur, the first Minister of Health of India and the first woman to preside at this assembly, said this, I quote, "The dark clouds that overshadow our skies today can and must be dispelled by the fulfillment on our part of the pledge to serve one another. Our work is surely a precious heritage which we may not forsake, and a positive factor for overcoming the root causes of conflict." End of quote. Today and this week, I ask you to remember those words from 1951, from the Indian late minister. We are here to serve not our own interests, but the 8 billion people of our world. To leave a heritage for those who come after us, for our children, for our grandchildren, and continues. And to work together for a healthier, more peaceful, and more equitable world. It's possible. Our current crisis is an opportunity to do just that. And together, we will do it. I thank you. Thank you very much.
Thank you, Dr. Tedros. Also, as per your instruction, Mabuhay is a Filipino greeting, and its direct translation is live long, healthy, and happy. I would now like to invite Dr. Katarina Bame, Assistant Director General, to kindly moderate the presentation of certificates of recognition to some countries for the public health achievements. Dr. Bame.
Mr. President, DG, Excellencies, let us now recognize and celebrate several countries, individuals, and organizations for outstanding public health achievements. First, I would like to invite Austria, Norway, Oman, and Singapore to come forward to receive their certificates of validation for trans fat elimination. We are honored to present these certificates today to the 4 countries that have put in place robust frameworks to eliminate industrially produced trans fat from the national food supply. Please join me in congratulating them.
Austria.
Austria. Norway.
Norway.
Oman. And Singapore.
Singapore.
Come a bit closer. Next, we are very pleased to recognize the remarkable achievements of the 2 countries that WHO has certified as malaria-free in the last 12 months, Egypt and Georgia. Egypt was certified in October last year, marking the culmination of a nearly 100-year effort, while Georgia also joined the ranks of malaria-free countries in January this year, following decades of targeted and sustained action. Georgia. Next, we're pleased to congratulate Botswana for becoming the first country to achieve gold tier status on the path to elimination of mother-to-child transmission of HIV as a public health problem. This is a very impressive achievement for a country with a high burden of HIV. Good. And last not least, we congratulate 11 countries that have eliminated one neglected tropical disease in the course of the past year. I would like to invite the following countries to receive their certificates of validation of elimination. First, Brazil for lymphatic filariasis. Timor-Leste, also for lymphatic filariasis. Chad for sleeping sickness. So back to Timor-Leste for lymphatic filariasis. Guinea for sleeping sickness. We now have India, Mauritania, Pakistan, Papua New Guinea, and Vietnam for trachoma. India first. Pakistan.
Thank you so much. Thank you.
Mauritania. I have Papua New Guinea.
Papua New Guinea?
Yeah. And Vietnam. Now we have Niger for onchocerciasis elimination.
Okay.
And Jordan for leprosy. Okay, good. So now finally, we are pleased to honor this year's recipients of the World No Tobacco Day Awards. Each year, these awards recognize exceptional individuals and organizations who have made outstanding contributions to tobacco control. It gives me a pleasure to invite, therefore, the following awardees. Dr. Lina Nanushian, First Deputy Minister of Health of Armenia. Dr. Franz Pietsch, the former head of directorate at the Federal Ministry of Social Affairs, Health Care and Consumer Protection of Austria. The National Board of Revenue of Bangladesh. The Ministry of Health and Ministry of Finance of Brazil. Temarae Ora, the Ministry of Health of the Cook Islands. Cook Islands. Coming? Good. An award to Malaysia, shared between Dr. Haji Zulkifli bin Ahmad, the Minister of Health of Malaysia, Dr. Norayana Binti Hassan, Deputy Director of the Disease Control Division, and Dr. Muniz Yami, President of the Malaysian Council for Tobacco Control. The Ministry of Health and Population of Nepal. Nepal. And the Directors General Special Recognition Award of Contribution to Global Tobacco Control is awarded to the Ministry of Health and Wellness of the Republic of Mauritius. So please join me in congratulating one last time all the awardees. Back to you, President.
Thank you, Dr. Bemi. Let us now suspend item 3. We will reconvene at 14:30. This meeting is adjourned.